Hello, it's Dr. Jeff Munn with Poplar Animal Hospital. Today we're going to discuss common blood panel profiles. These are the blood panels that we're looking at that are sent out with our annual blood screens on our patients that are coming in for their annual visits. Here you'll see a common lab report that we will get from our laboratory, and I'm going to go through these in a section. This is the more comprehensive panel, and if you've seen the slideshow where we're talking about wellness plans, this would be the blood panel that would be included in the upgraded or the plus plan. The essentials plan or the standard blood panel profile will not include some of these values that we have here, and that's something that you would discuss basically with your individual veterinarian that you're seeing at the time to decide which blood panel profile that we're looking at, and as we go through it, it makes more sense. So the common chemistries, and a lot of these will be found in the basic blood panel too. It just may not be as extensive in each category, but the body proteins, there's your total protein here, and right below there we have these kind of grouped together, which is nice. The albumin and globulin together will make up the total protein number. The ratio, I don't think any of our doctors in our practice really put a lot of emphasis on the ratio. You're really looking at the raw values. The second set of values that we're seeing has to do with the liver values. There's a good grouping here of 5 different things that we look at for the liver. ALT is one of the more specific liver values. Alkaline phosphatase is something that we see in many cases that is elevated in older dogs for different reasons, and that's another topic for another day. But overall, this gives you a good look at how the liver's doing, so to speak. Total bilirubin it's basically a function of when that level would be elevated significantly, it would correlate with icterus. So that's a yellowing or discoloration like jaundice. There are some different causes for that, which would be a separate subject, but that's what that value is picking up for us. The third area here, which we have boxed off, is your kidney value evaluation with the blood urea nitrogen reported. Most of us in the veterinary world call that a BUN. And then there's creatinine. So these two are very commonly looked at for kidneys and how the kidneys are doing. Again, we get a ratio. There are some benefits to seeing this ratio with certain issues like esophageal reflux disease, which is more of a human problem, but we do see it on occasion, and ulcerations in the intestines, things like that. Phosphorus is associated with the kidneys to a degree, so individuals or some of our patients that do deal with kidney disease, we track their phosphorus because as it elevates, it does have an association with making patients with kidney disease not feel as good as it gets higher. So that evaluates our kidneys. As we go forward, we also are going to get a look in our blood panel at the electrolytes and the minerals. Calcium is an important mineral in the body. It has to do with muscles. You need your calcium for muscle use. Magnesium, we don't see as many issues with magnesium as we do with calcium, but sodium, potassiums, those are always good to have. Lipids, cholesterol, triglycerides, amylase and lipase, look at the pancreas, their pancreatic values. So very complete chemistry panel on our comprehensive here. Many folks have heard the term CBC. It's often seen on the shows ER, things like that. You'll hear a CBC Chem 7 or something. What a CBC evaluates is it's going to evaluate for red blood cell problems like anemia, platelet issues, which has to do with your clotting, and it will also give us a look at the white blood cells for infection and some other indicators. So in this example here, the white blood cell count 8.8 correlates really to 8,800 white blood cells that we're seeing there. The red blood cells and some of the indices for the red blood cells with how large they are, the mean volume of how big the red blood cells are, And then platelets here, this platelet count is reported as slightly low. However, in our patients, we do occasionally, or more than occasionally, we can see the platelets begin to clump together. So if they cluster together, the machines will not read them properly and will report a falsely low value. We will get an alert that states that the platelets were clumped in. When the technician reviewed the slide, they found that the platelets were adequate. So this is a problem with the paper in the machine, is not a patient issue. So that's important. It would be a scary thing if an owner were to see a low platelet count because it has to do with clotting. However, we know in this individual it's not a problem for that individual. It had to do with the platelets getting kind of sticking together. The differential count actually breaks down the white blood cells into different groupings, and we know that, for example, if the eosinophils are very elevated, that individual more likely would have either an allergic or parasitic problem going on. So we get a full breakdown of that total 8,000 count. You would add these up and you would get to your 8,800. A thyroid screen, this is recommended mainly for dogs that are over the age of 7, and if it's in the normal range, we know that the thyroid is functioning and producing hormone properly. If it's low, there are other things we have to do to confirm it, but the normal means it's normal. Heartworm screen and intestinal parasite screens are included on the what's typically termed the senior. Some like to call it comprehensive because we may want to run this more extensive panel on pets that are not at 7 years of age or older. We can do that in younger patients too, in particular instances. So as we described the differences in what is termed often a standard panel versus a senior panel, there are two panel options. Typically the more comprehensive, which we covered here, is going to be recommended for those 7 years and up. There are certain instances where we have a patient, an example, we have a relatively young patient who deals with a condition that he has called Addison's disease. We really need to track his electrolytes. So we are looking at doing the more comprehensive panel, even though he's like age 4. So occasionally these guidelines are just that, they're guidelines, and we will occasionally kind of break the rule, so to speak, of senior, and it will be recommended, but that's on an individual basis. So hopefully this is helpful so that you know when your pet gets their annual blood screen and panel done, what we're seeing, what we're looking for, and when you get that report that things are normal, you know what we're talking about. You can also find us on the web. We are at www.popularanimalhospital.vetsuite.com, and we also have a Facebook page at facebook.com/Popular Animal Hospital.